Hey everybody, it's Dr. Amir Rashidian at Mid-Atlantic Chiropractic Center, and today I thought about discussing neck pain with you. Neck pain affects a lot of people. Everyone's had neck pain at some point. Sometimes you just say a family member is a pain in the neck, but that's a different topic. Today we're going to talk about actual neck pain, pain that is in the neck, and there's many causes for that. There's so many things that happen in the neck. For example, we have a saying, we say beneath every brilliant mind is a neck, and it's so important because your neck holds up your head, it helps you turn your head, and it's also the connection between the rest of your body and your brain. Your brain is the center that controls everything that happens in your body. Your brain knows what's going on in your kidneys, your liver, your stomach, your pancreas. Everything is controlled by your brain. Your brain controls blood flow as well. So your brain tells your body where to send the blood. So if you eat some food, it'll take blood away from your muscles and tell the blood to go to your intestines. And if you're about to do a run or an exercise, it'll take the blood away from the gut and put it into the muscles. And if you get embarrassed, then the blood goes to your face because then you turn bright red. And if you get scared, right, the blood leaves your face and you get pale, right, because blood is leaving your face and your hands. Some people have poor circulation. Some people sweat a lot in their hands. All of that, believe it or not, is neurologic. Nerves are telling your body how to do those things. Well, every nerve that controls everything below your neck has to pass through the neck. How important is it to make sure the neck is aligned properly? So some of the causes of neck pain can be disc issues, and we've talked about discs in the past. Mainly we were talking about low back discs, but all the information I gave you about discs do apply to the neck as well. Between the vertebrae of your neck, there are discs. Here's an example right here. So the neck, these are the bones of the neck, and the spaces you see between them are where the discs are. And so one of the things we need to do is we need to take an x-ray, and we need to take a weight-bearing x-ray to see what the bones look like, what the discs look like. And if there's misalignments, we'll find those misalignments and correct the misalignment to take pressure off the nerves, to take tension off the spinal cord. The top of your spinal cord is the thickest part of your spinal cord, because as the spine comes down the spine, you see how nerves branch off. And every time nerves branch off, the spinal cord gets smaller, thinner, and narrower, where when you get to the lower spine, the lumbar region, you just have a shred of nerves. You don't have a full spinal cord anymore down low. But up here, it's pretty thick. At the very top, which is called the brainstem, it's the thickest part of your spinal cord. The brainstem is also, quote unquote, the fuse box of your body. By fuse box, it's kind of like it's the router, right? Signals come in from your feet, from your hands, from your gut. They go to the brain. The fuse box, the brainstem, decides where those signals go. If the brain needs to talk to the body, same thing. You know, in the old days, and most of you are not old enough to remember this, but I do, and I won't tell you how old I am. There used to be this person called the operator. And if you picked up your phone, you could dial the operator and you would say, hey, I want to talk to Dr. John Jones, for example, in Frederick, Maryland. And she would say, hold please, I will connect you, and they would push the button and they would route your phone signal to that person. So we don't need that anymore. We don't have those phone operators, but that's how it used to be in the old days. Well, the brainstem is that operator, that fuse box that makes sure that everything's routing properly. That's why pressure on the brainstem is not good. And the fact that the brainstem is the thickest part of your spinal cord means smaller misalignments at the top can have bigger impacts on your body. When the first bone in the spine, this first bone, if that's ever misaligned, you're going to end up with things like ADD, ADHD, sleep apnea, insomnia, depression, anxiety, mood swings. It can cause headaches, migraines, dizziness, lightheadedness, ringing in the ears, numbness in the face, metallic taste in your mouth, and it can cause you to sigh a lot. Those are people who, in the middle of their speech, they're talking, they have to stop and go, because they almost forget to breathe properly. All of that is controlled by that brainstem. It's critical. And the vagus nerve comes out from above C1 at the very top from the brainstem. And if you look at this chart right here, this green one, that's the vagus nerve. And you know what they say about whatever happens in Vegas? is important. Just kidding. So let me show you a couple of x-rays. So this was a gentleman. Now this gentleman, his main condition was something that chiropractic could not fix. He had a neurologic disease, and I don't want to name the disease because it'll identify the person, but there was a disorder that kept him from being able to bring his head up. So his head would constantly hang down low, and he was developing a lot of pain in his neck. The reason he was developing pain is because it was causing the discs in his neck to degenerate. And so when we started working on him, our focus was, let's see if we can get some pressure off the nerves and create some space in those discs. So we did a technique called decompression on his cervical spine, on his neck. And let me show you the x-rays right here. This is this original x-ray. And these blocks are the bones, and the dark space between the bones are where the discs are. Now, this is before and this is after. Now, look right here. You see how there's a wider space between these two bones than there was before. So this is this disc. This one is that disc. This one is that disc. All of them opened up, even this one. This one still has some degenerative change left in it. And I'm not telling you we can reverse degeneration and arthritis. That's not the case. But when you create proper alignment, hydration in the disc can improve and it can expand that area. His neck pain went down, his mobility improved, his strength improved. Now let me show you another x-ray. This is the first x-ray. What I want you to notice is this small red line represents what we call the spinous process of C2, and the long red line represents the center of the spine. Those two need to line up perfectly. If you look at the model right here, I'm going to turn him around. This is C1, this is C2. Brainstem is way up there. This bone on this young lady is off center, where the bone is rotated over here. This needs to come back to center. Can you see how that rotation could affect the brainstem? When it does, it also affects blood flow and circulation to the brain as well. This is before, this is after. The rotation went from 3.07 millimeters to 1.25 millimeters. And that alone was enough to eradicate all migraines. Her migraine headaches disappeared. Let me show you a different x-ray. She's a bit older. She was having severe neck pain, and pain would go down the arm. She had numbness tingling in her hand. And it took us quite a while to improve this, but I want you to notice there's no curve in the neck right here. These are the bones of her neck, and this red line represents the normal curve. Now notice how the bones of the neck follow that red line, and now we have a curve. This is about 13 months later. The bone spur is still there, but because the curve is improved, now the pressure is not on the nerve that controls the hand, which is the brachial plexus. And because that pressure is off, she has full strength back in her grip strength. There's no numbness tingling in the arm, and there's no neck pain. So correcting the curvature improved that. Also, there's a lot of research and data. Neurophysiology research shows that loss of curve in the neck not only puts tension on the spinal cord, it also reduces circulation to the brain. Let me show you how that works. If you look at Charlie here again, you notice this is the normal curve. The spinal cord is inside. That's the brainstem up there. And notice what happens when I reduce that curve. A straight neck causes stretching of the spinal cord. That's tensile stress on the spinal cord. It also reduces blood flow. See these blood vessels on either side of the spine? These blood vessels can't send blood properly to the brain when that happens. Critical that we work on restoring that curve. Sometimes that can happen sooner, sometimes it's later, but it requires chiropractic adjustments, exercises, rehab. You got to do your part at home. We'll do our part here. So hopefully that helps you. Hopefully that gives you some examples of what can happen, what can cause some neck pain, and what some of those solutions are. If you have questions, let us know. Call us, contact us, email us, put a comment below, and we'll be back with you with another video soon.